Okay. Well, I am really excited to dive in. And the answer is yes, Hannah. Let's do that. Perhaps right before, why don't we do some personal introductions just to kind of set that stage? And then I'd like to hear about your assignment, the topic that you're trying to advance. And then let's figure out some great strategies to help you be successful. So, with that, why don't I introduce myself, and then I'd like to hear a little bit about you guys, so that I kind of, have a better idea of your background and how I can be helpful. So, my name is Robert Rogers. My training is journalistic by trade, and I worked at the San Bernardino County Sun for many years, and I followed that with the Contra Costa County Times. I also earned my graduate degree at UC Berkeley's Graduate School of Journalism, and I serve as a visiting lecturer there on an annual basis as well. I entered public service 8 years ago. I now work at the county supervisor's office, Contra Costa County Supervisor John Joya. We are great partners, friends, and admirers of Lifelong and the great program that you're involved in. And also, public health and public health equity are the, bar none, number one priorities for this office and how we can best serve our constituents. So we're really excited about you, about your program, and we're also really excited about how to use communications technologies, techniques, and the craft generally to advance these scientific and public service objectives. And we think that they pair really well together. And we're so excited that Lifelong is interested in hearing what we have to say about this also. I'm also a Richmond resident and a husband and a father of 3 young children. And again, I'm just really excited to chat with you guys, meet you, and help you be successful in this endeavor. So with that, maybe I can hear a little bit from either you, Hannah, or you, Mahmoud, and then we'll get into the craft.
Sure, I'm Hannah. Nice to meet you. I grew up in San Francisco and went away for undergrad in Santa Barbara and came back to med school in the Bay in Vallejo for medical school. And then now I'm here working in at Jenkins in Richmond. Excited to be in my final year of residency. And I currently live in Berkeley, which is good. We commute a lot in the residency. We work at, every major hospital, Contra Costa, Highland, Kaiser Oakland, Richmond, Alta Bates. So it's nice to be central. And I have an 8-month-old son. So he keeps me busy. And on a very high level, my capstone project over this year is thinking about healthcare for the unhoused population, specifically in Richmond. And as I look at this op-ed, I feel a little overwhelmed just like trying to narrow the topic because like it's such a big one and there's so many different things you could focus on. And also like a lot is already written about it. So just like trying to think more about like my direction. My dad also has a journalism background and he's an affordable housing attorney. So I was talking to him about like his perspective and everything. So right now I'm sort of thinking about like maybe calling for more funding. Like we have I like was doing a lot of research within Richmond and Contra Costa County on what already exists. And there's a lot of, effort already towards like helping fight homelessness. But I was thinking about writing more about increasing the funding from the healthcare perspective, like with the lens that healthcare is housing. And we have money coming in for affordable housing, but that money could also come from the healthcare bucket with like the lens that we will save money on healthcare if people are housed. So that's my thought, but I'm very eager to get your tips on how to kind of tackle that. And I'll pass it over to Mahmoud.
Oh, before you do, very exciting. I love the topic, want to dive into that, have a lot of ideas. And hey, congrats, an 8-month-old and doing your residency. Well, my goodness, as a father of a 3-year-old, a 4-year-old, and a 9-year-old, I know what that's like. And or I know a little bit about what that's like, and that's really amazing. So congratulations,
Thank
and
you.
loving it. Looking forward to it. Mahmoud, let me hear a little bit about you, please.
Yeah, thanks for having us. So I'm Mahmoud. I'm also a third year resident, entering our final year of family medicine. I was born and raised in Oakland. Went to undergrad at UC Berkeley, majored in integrated biology with a minor in education. Um, Life took a different turn. Ended up going to the Caribbeans for medical school in Dominica, which the medical school is now in Barbados because of the hurricane that destroyed the island at the time, which I managed to like escape before it all happened. Um, and and yeah, I have three kids of my own, a 5 year old, a 3 year old, and a 2 year old. Um, and they keep me busy every day, and life is a little tough when you're in residency and juggling life with work, but here I am hanging in there and making the most of it. Um, as far as my capstone project, I've been thinking about adolescent prevention of adolescent obesity. I feel like that's a topic that it's quite challenging, and not a lot of resources out there to support children in their development and prevention and obesity. And the topic of area that I chose to kind of for my open for the open ed topic is illegal dumping and wasting. Um, and so we were talking about this morning, but yeah, I'm trying to find just correlations into how illegal dumping and wasting is impacting like children's health, and impacting their access to like parks when you see all these trash and just illegal waste, preventing access to kids to be able to use these public spaces, for exercise and daily walking and things like that. And there's a lot of resources out there that they're trying to do to kind of prevent illegal wasting, as far as like reporting illegal dumping using specific apps that are designed to crack down on these issues, and fines and all kind of like citations, and increasing like dumpster days and things like that. So I'm just trying to just trying to piece the two together and see how we can further support um, prevention of like adolescent obesity with regards to like environmental challenges.
Excellent. Well, I can't say I can't be more impressed with our residents at Lifelong Medical Center, uh, doubling as parents and all the time. That's amazing! Wow, way to go! And really, really happy to hear about your young families. And wow, what a joy! But I mean, to couple that with medical school or residency is it's pretty amazing, pretty intimidating, pretty wild, and very praiseworthy. So well done. So, as we get started, I want to make sure I want to be as efficient as possible. Now, this is 1/2 hour. Is that right? Okay. Now, if we need to go a little over, no problem. I'll be with you, but I'm gonna really aim for our 20 minutes that we have until noon. So, what we have, I'll just do some preliminary points. Then I'd like to hear more about each of your projects, and then I'll be more specific and more kind of surgical in my assessment of the best way to do that op-ed given that particular topic and some of the ins and outs on that. Now, when I hear from both of you about your proposed topics, I like them both a lot, and I think we have a lot to work with. One thing that comes to mind right off the bat is simplicity and clarity in any public communication document of this kind. This is the whole point of an op-ed like this public communication by a responsible person whose opinion and ideas matter. And in this case, very much so, being physicians or public health officials and physicians. This is about persuading people to not only believe what it is that you're trying to tell them, but even more important, to be passionate about it, to truly believe with emotion, and then ultimately, the big one, to act, to do something different in their lives, given the persuasive piece that they've read in just a matter of a few minutes. And I stress few minutes because this isn't a journal article. This isn't a research paper. This is public communication, and it has to be short, powerful, persuasive, and memorable. And how do we achieve that? Well, I don't like to throw around arbitrary numbers, but I do know that this has got to be short. 750 is a common number that you hear a lot in terms of words. And I would say that's on the long side. That's the kind of thing that you want in your heavy duty New York Times op-ed that I know I grew up reading, and you probably did too. But often our best persuasive pieces are more like 300 or 400 or 500 words. But that said, 750, I would think of that as like the high end of where we want to go. And then now I want to get into the details, but I'll also say a few other things. And that is, authority matters, right? Legitimacy matters as an author. Now, you have that MD right there in your title at the byline. So your authority is going to be without question. And it's going to be sprinkled in that piece as you talk about some of the data points, some of the things that you understand that others may not. You are a doctor talking to the people, and that affords you a great deal of latitude and strength. But what's more important in your writing, the pitfall, is not being not authoritative enough, but slipping into authoritative speak in a way that makes people either gloss over or even tune out, right? Authenticity, transparency, friendliness, relatability, these are your most powerful tools in the communication that you do. If you lapse into authoritarian or stentorian doctors speak to people, well, that's not something that folks tend to respond to. So we have to be conversational, transparent, open. We have to be persuasive, and we have to be clear and simple. What is the topic? What is it that I'm trying to tell you? Because I'm going to tell it to you. I'm going to tell you hopefully some stories that reinforce it. I'm going to give you some data points that prove it. And then I'm going to tell you again. Now, when I heard Hannah talk about hers, that seemed very clear to me. I got that right away. It was simple and it was honed in, right? How do we advance healthcare to the unhoused? How do we better the health of the unhoused? Mahmoud, we have a little more difficult scenario with you, perhaps, because I heard you talk about adolescent obesity. Oh, I'm in. Huge, awesome, great topic. But you also talked about the way that illegal dumping, right? Unfortunate or improper disposal of waste in our communities, how that might factor into. Okay, well, that could be a great data point, but we have to make the choice right off the bat. The paper, the point we're making has got to be more simple. It's not adolescent obesity is a terrible problem, and it's being caused in large part by improper waste dumping, right? We have to choose which are what. So if the point is really the health impacts of either the thrust of the story is the health impacts of improper waste disposal, and then amongst that we'll get into the adolescent obesity and other things, or the inverse, the flip side of that would be adolescent obesity is a terrible problem. And one of the things that contributes to it is the improper disposal of waste, right? We have to do that. The point of your piece has got to be clear, direct, and something that can be summed up in just a sentence. We have to have that thesis really locked down. So with that, let's move in. Let's talk a little bit more specifically about each of your pieces And let's talk about some tools and tricks and tips to make them as good as possible. Who'd like to start?
You sure? Okay. So we can start.
Mahmoud, let me hear a little bit about what it is that you want to do with your op-ed, what you want to accomplish.
Yeah. Yeah, I guess I guess I what I want to do is talk about it in a sense that like illegal wasting is one of the contributors to pediatric obesity, not the contributor. But we could also take it in a different approach in terms of how the overall impact of pediatric health through illegal wasting, which also is a contributor in some sort of way, and resulting in decreased activity and increase children's weight by limiting their ability to access public spaces when there's so much waste and disposals in the area. So I guess we could probably just focus on just how illegal wasting can impact the general health of pediatric population, but also a contributor to pediatric obesity through impact of physical public space that children could have access to.
Okay.
Seems a little bit.
So that this is great. I love the way that you describe this. And a new idea dawned on me. The way to do this, I think, most effectively is to use the surprise, the didn't see it coming trick right off the bat, right? So what we can do is we can really turn the complexity or the tenuous connection of something, we can turn that to our advantage by giving people an opportunity to see something in a way that is extremely novel, creative. We're going to make a connection, a logical connection, and a connection in the synapses of our readers that they wouldn't have made before. That'll be memorable. In other words, we've always heard about pediatric obesity. Everybody knows how bad that is. And there are a million different contributing factors we can talk about. But if we start off, if we're all about pediatric obesity, that's interesting. We can build a great piece on that. But what if we built a piece on this incredible concept that, wait, that illegal dumping that I think of as such a nuisance, that I call the police about and I get angry with, or maybe I've even been guilty of doing it myself once or twice, right? I hope not, but maybe someone's dumped a mattress or something like that, right? To avoid a cost. I never thought of that as destroying the health of children, making, worsening pediatric obesity. Whoa, what? That's interesting. Tell me more. Then the challenge will be, right? How do I provide some supporting evidence that convinces me as a reader that this really is a thing? Because if I'm convinced, I'm going to remember it because this is so novel. It's so different. It's so out the box. And ultimately, I'm going to be more passionate about a topic now that I've made the connection to this, which is an even more insidious problem than what I thought about before. Because we all know that it's bad for our watershed, it's bad for our public space, it's bad for these things. But contributing to childhood obesity and presumably reduced life expectancy, morbidities, and so forth, and ultimately hitting the bottom line of all of our wallets on a public health basis, wow, that's brilliant. And that's interesting. And that's something that I won't soon forget. So what I would say, and let me just give a brief sort of tantalizing idea about how an op-ed like this could go. Then let's go to Hannah's. Let's do some on that, and then let's circle back. So with a piece like yours, right, I might start with something like a relatable anecdote that everyone has seen, right? I can't tell you how many times that as I rolled up to our local park with one of my children, right, and I saw mattresses and other refuse dumped right there. And that deterred us that day from going to that park, and we went somewhere else. What if I told you that America's epidemic of childhood obesity is related to a quality of life problem that many of us understand, but had no idea just how bad it could be? Excuse me. In other words, the epidemic of improper waste disposal and dumping in our public spaces in our communities is indirectly feeding the epidemic of childhood obesity, lowered life expectancy, and other comorbidities. These problems are linked. They're terrible. We can do something about it, and here's why. Then, now there will be a challenge here in coming up with some data points that suggest the veracity of this, right? It might be difficult to make this connection. I have to leave that to you. I haven't done any research. I haven't heard about this before, but we have to come up. Maybe there's correlations between communities where we have high rates of childhood obesity, along with high rates of illegal dumping and other environmental despoiling that's occurring, right? And then we have to look for, after we've convinced them of this, we have to look for the action. Now, readers want that. They want to know. They want three things. Our readers want three things. They want to know what the problem is. They want to be educated about the problem. But unfortunately, too many op-eds really just focus on that, and that's never enough, right? Being aware, being educated, that loses its luster really quick. Number two, I need to be emotional about it. I need to be invested. That's why anecdotes work so well, right? If you tell me about how your 5-year-old looked at you so sad when he saw that huge dump on the soccer field and he couldn't play, I'll remember that. That'll touch me right here. And you'll have me when you start telling me what I can do to make something like that better. Anecdotes are powerful. So I need to be educated. I need to be emotionally fired up, engaged, outraged, whatever it is. And then lastly, I need you to show me something I can do. And the smaller, the better, right? The easier I can accomplish. Because if you ask me to quit my job and focus everything on stopping illegal dumping, I might not be with you, no matter how great your op-ed was. But if you give me one ballot initiative to vote for, or one volunteer opportunity, or one lifestyle habit I can, even if it's as simple as picking up a piece of trash every day that I walk to the park, right? Give me something to do, and you'll have a friend and colleague and a partner in this thought experiment. So I love your piece. I have more ideas about it. I want to get back to it. Hannah, let's go.
Yes, I feel like I'm not sure about my ask really, and I do maybe have some anecdotes. I'm just not sure because of my direction, like even just how we work in the ER, and like disproportionately, like people that come through the ER, like disproportionate amount of them are people who are living on the streets, or disproportionate people who are unhoused, have, disabling conditions. And then also my other anecdote is like on the patients that I do have, some of them that are homeless are trying to find shelters, and they're calling 211 and doing all the things, and there's just like these long wait lists. They can't get in. So those are my two.
Let me stop. I hate to interrupt, Hannah, but let me put the spotlight on you really quick. And let me just say, I have a lot of ideas. Mahmoud's really, really was a challenge for me, right? I've never heard that before, but I love it, right? It's so engaging. And I had to think creatively about new ways. This one I've thought about a lot, right? And that's good. That's a great thing also. What is it exactly that you want to say in your op-ed? What's the thesis, Hannah? I thought I heard something earlier I don't want to jump the shark on that. I want to hear it from you. What's your thesis?
Healthcare is housing. I don't know what my thesis
Okay,
is.
that's good. That's good. Usually the problem is the thesis is too long and circuitous, right? In your case, I just need a little more, right?
Mhm.
Healthcare is housing. Love that. But what are we trying to accomplish? Is it to let people know? In other words, is it we need to be thinking from a public health perspective how to reduce homelessness? Or is it more that reducing homelessness is a public health net benefit for all?
I think maybe the second one, although I could easily do both.
Okay. Okay. I like that second one too myself, right? Because there's a million op-eds about homelessness, the unhoused, people gloss over that, right? But what's one of the most powerful rhetorical tools that we could ever have in our toolbox, right? It's this sense of internalization, right? This isn't something that's occurring apart from me. This is me, right?
Mhm.
And you have a much easier case to make when you're talking about how to improve public health for all as a mission with the unhoused. That's an easier, you're telling me right there, this affects me. This is my health. My health is linked to the homeless person that I stepped over on the way to wherever I was going.
Mhm.
That's powerful, right? Because we can allow homelessness to continue. We can disengage from it because we think that it's existing apart from us. It's not going to affect us any more than some inconvenience of seeing something on the street. But it's much more powerful when you tell me the homelessness crisis is affecting my family, myself, my children, and so forth.
Mhm.
Helping homeless people be less homeless and less unhealthy is best for all of us. So that's the thesis. That's a power thesis, right? Now, then you'll have to marshal some data points to note that. It might be things like, you might be linking poverty with life expectancy. You might do things of that nature, right? But what's really crucial, let's go back, is we got to have that power anecdote. Now, you also, as an MD, are a perfect person to make this case. So if I were writing your piece, if I was in your shoes, what would I be thinking? I'd be thinking something like this, something like, it was just another, Saturday morning, my shift at the hospital, and the police brought in this man, right? And he, after I gave an initial assessment, this homeless man suffered from a range of physical maladies, right? And we had to create a treatment plan. The crisis of the unhoused has not only contributed to his personal terrible health situation, but it's also it's commanding the resources in our facility we deal with daily. And this drastically affects the health of our community in a number of ways, the health of all of us in our community in a number of ways. And then we're going to start talking about the ways. That's where you're going to have to marshal some data, maybe another anecdote. You're going to have to show that, communicable diseases are being furthered by our unhoused population. High blood pressure is an epidemic that's creating all these other cardio things. They're filling our emergency rooms, so we devote resources there that could go somewhere else, right? So you have to show us how thousands and thousands of people on our streets in unsanitary, unsafe conditions is degrading the public health environment for all of us in all of our systems.
Mm-hmm.
And then you come back to that at the end, and you go back to that anecdote. And when we fixed this guy up, we gave him the medicine he needed, we reduced his blood pressure, we did these things. But sadly, we had to discharge him, and he walked out the door, probably to the same terrible place, and he'll probably be back in a couple of months with all those problems again, because we can't practice good public health or good medicine in this untenable situation, right?
Mhm.
So now we've created this new context in which the unhoused becomes a threat to public health for all.
Mhm.
Okay. Now we are at 1/2 hour. I'm comfortable going farther. If anybody needs to drop off, I totally understand. But with that, let's go with follow-up questions.
Mahmoud, did you want to?
Yeah, so yeah, no, I mean, I like the idea of the whole public, illegal dumping, wasting. I mean, I think I could have probably focused probably more on like public space availability for like, like parks and community parks and stuff like that and access. But I think I'm gonna stick with that. Reason why I didn't do the first the alternative option was my previous colleague, was discussing public space, and I thought maybe I should find a different
No,
topic.
Mahmoud,
But
I totally agree. I think this is the right decision you're making. I
okay,
think that you definitely want to embrace the novelty, the creativity here.
okay,
For yours, this is big. It's really good. This idea that linking illegal dumping with childhood obesity. And it's not just about illegal dumping making public spaces less usable, but that's one. There has to be a couple other things, a couple other ways that illegal dumping impact health and childhood obesity, right? And you've got to, maybe the connection is tenuous, but it's memorable, it's fresh, it's interesting. And so you
yeah,
can make that. I totally encourage you to make that case. Also, let me just squeeze in some more tips while we're talking, right? I've already mentioned the power of a very brief anecdote, right?
I have
Like
that one
in
down.
Mahmoud's case, definitely something like, I saw this happened, and that's when it dawned on me, right? That's really amazing. Short sentences, vivid descriptions. If you do tell an anecdote about that park, show me something, right? Tell me, don't you've heard in show not tell from your literature classes when you were in junior high, but that's really works, right? If you're going to tell me that a park has been dumped on and me and my kid walked away sad that day and didn't get to exercise, show me how that mattress was, half burned and charred and the other half covered in dark urine. Show me that, that amongst the refuse that I saw in the softball dugout was a couple of hypodermic needles glinting in the sun, right? Show me something. Give me an image, especially a terrible image, and I'll remember that, and
Yeah,
you'll have me more invested.
yeah. The anecdote portion, I think I can come up with that, but it's just the I think you mentioned some evidence or data points is where I think it will be a little challenging. Um, the connection between the
Well, you'll
two.
definitely be able to make a correlation between communities with terrible environmental factors, including dumping, and reduced public health. You'll be able to correlate those two. Obviously, you can't prove causation. And I know, I realize I'm talking to doctors. I don't need to tell you these things. But the other ones might be more challenging. But you could come up with novel ideas. You could say something like, imagine if rather than spending all this money, you could make the case of like this massive waste of resources at the municipal level to clean these things, and how that detracts from either direct healthcare spending or further park usage or recreation programming. You can make those cases, right?
Yeah,
The reality is that anytime there's a huge waste on something, we can always take the liberty of saying that waste could have been invested in this thing that I'm passionate about. You see that
okay.
that trick
Yeah,
that trick gets played all the time in the media, and it's effective.
got it.
Hannah?
I'm trying to think about my like small ask. My ask is big. It's like about public health and how, I guess how you should care about it, and how like maybe the ask is just to like have compassion, and I'm not sure. It seems so hard to
Well,
a small ask.
I would, if so, excellent. You're right. I would think about this, right? Think about the ask and come up with something, whatever you think might be most effective. Now, remember, the big asks are the bigger the ask, the less likely you're going to get much following on it, right? The smaller, the better. Because what we're looking for here is not one person to swoop in and fix the problem, but we need collective action. Collective action works when there's small little ripples that build into a mighty wave, right? To quote RFK. So what we're talking about here could be write a letter to the governor asking for this, or it could be think about donating or supporting to nonprofits that see the problem this way, right? Or write a letter to your healthcare provider to do more for our, if you're a Kaiser member, get Kaiser to do something more, right? So it might be oftentimes it's support a particular piece of legislation that's out there. Now there may not be one, so we wouldn't be able to have that. But if there is one, that's always an easy ask, right? Vote for this.
Mm-hmm.
Another one could be something like, think about, when you see the unhoused in your community, don't be disgusted. Don't engage them. Don't walk up and give them money. But, think about what organizations I can support that are really about the holistic health of our unhoused. Because our unhoused are not going to be housed if we fix one little problem. Just like health, the unhoused are suffering from a whole panoply of problems, right?
Yeah.
And we have to approach the unhoused holistically, like we approach a public health problem or a personal health problem.
Mm-hmm.
It could be something like that. Or it could be, like I said, it's, write a letter to a candidate or a political official, reach out to nonprofits or maybe donate to nonprofits that do the right job. Ask your healthcare provider to do something different, or vote for or support a certain policy that's out there.
Mm-hmm.
Those are obvious
Okay.
ones. There may be more that I'm not thinking of, but
Okay,
come up with something that you want people to do.
Mm-hmm.
The awareness and the emotion are two powerful things that you're sparking with your experience and now with your communication.
Mm-hmm.
It'd be a shame to not get that last thing, not to use
Yeah.
those to channel that into action.
Mm-hmm. Cool.
Also, some more tips as you're writing, right?
Mm-hmm.
Think about things like short sentences, anecdotes, vivid descriptions, small asks. Think about authority, being a doctor, being a public health professional, right? Think about, don't be authoritarian, but it's never a problem to sprinkle in there what I've seen in medical practice, that kind of thing, right? Remind people that your opinion is a learned one and one to be respected. Reciprocity, right? Everyone wants reciprocity. You can't promise to do something in particular for that reader, but you remind the reader what their action could lead to. That's an element of reciprocity, right? Do this one thing for me, and this is the vision that we can achieve. So that's not only is that goal setting and showing the grand vision, but it's also on a personal level, reciprocity. It's what you do not only matters, but it'll benefit you too.
Mm-hmm.
These are really powerful psychological triggers that we always want to plant in the reader's mind.
Definitely.
Also, think about social proof, right? It never hurts. Like in the case of the unhoused, it never hurts to sprinkle something in there of, I'm a doctor, I see this in my practice, but we've all seen it. We all know. Everybody is always excited about this. That's why it's always good to throw in a poll number, right? If, for instance, Hannah, for you can say something like, the recent Gallup poll says 84% of people think that unhoused populations are a main threat to their community's health, right? So it's all, why do we like that? Because we're herd animals. We always want to hear that a whole bunch of other people are thinking the same thing that we are. It gives us safety and security in thinking that we're right. So offer me some social proof when you have it, and you both have it. It's just a matter of finding it.
Thank you. This is really, really helpful. I feel like I
My
could.
pleasure. We are 11 minutes past time, but I'm still here for you if you need it, but I don't want to hold anybody. Mahmoud, do you have anything else?
No, that was great. I really appreciate your time. It did give me a little bit of kind of perspective in terms of moving forward and elaborating on the piece.
Thank
Hopefully
you.
we can come back
Hannah?
next week with some examples and some progress.
Yeah, I want to just say that I'm really excited about both of your topics. I really hope that you can be, and I'm super excited that folks in residencies like yours are learning these kinds of skills, finding time within your curriculum to think a little bit about these kinds of skills also, because ultimately, so much respect for what you do and doctors and so forth, but the greatest doctors are the ones who sort of step out of their offices and they speak to the broader public about big issues. So needed, such a desire. On the issue, Mahmoud, I'm super excited about your topic. I think my personal opinion is that your ticket to being really persuasive is making this sort of radical connection. I think that's really fresh. That's the way to go, right? Illegal dumping, massive impact on public health. And you mentioned, adolescent obesity. That's even a finer point. You can do it, but just public health and dumping, love it. And then, so that's really novel. Hannah, yours is kind of novel too. Of course, the unhoused thing is super familiar to everybody, but most of us don't think of the unhoused problem as a threat to our health. But I think that's your ticket to being super persuasive in your piece. This unhoused thing is a huge problem. It's a problem on its own. The unhoused, their health is deteriorating, and everyone is I do no harm. I've taken the Hippocratic Oath. I help all these people, but I have to bring it to your attention that it's hurting. It's not just hurting Bill or John or whoever I just saw that morning who has a whole host of terrible conditions he's acquired on the street. His health impacts our health. That's a good one.
Yeah.
So with that, I'm super excited. If either of you have any follow-up questions, want to email me, want to call me, talk to me anymore, I'm open to you. Otherwise, I just hope to hear something about your really successful piece that becomes a sensation in the future. Your piece de resistances.
Thank you so much.
Thank you so much. Appreciate it.
Okay, have a great day.
You too.
Bye-bye.
Take care.
Have a good one.